hospice is just much less about dying. We're all going to do that. And it's more about living the best we can until we die. And this really rang true for me. I've known this and I work with this on a daily basis, but it came true for me this week. I'm educating another new nurse who's going to be fabulous. They come from all their experience is in critical care where they've done absolutely everything and nothing's worked. And now they're dying and they die in a hospital. And so this nurse really understands how the body dies, which is a really valuable information. But as this nurse was working with me this week, following me around, watching, they were a bit shocked, like, oh, this is about managing bowels and making sure that they're as comfortable as they can be, dealing with, honestly, crazy family dynamics, which is the norm. And watching this enlightenment come like, oh, the hospice really isn't about dying. It's about this much of it, which we're all going to do. And hospice really can help people be much more comfortable through that transitional and active dying process. But it's the weeks and months before. People don't realize that you don't have to be actively dying to come onto hospice. That I see it all the time. People come on, they have to qualify, of course, but they come on hospice, whether it's depression, anxiety, pain, chronic constipation, all those things. We're really good at addressing really quickly, juggling family dynamics, normalizing that all of our families are a little crazy and that we're all going to die, and watching the light bulb go on for this young, beautiful nurse who's just excellent nurse. It's going to take some time to learn the skills for this end-of-life process, but it's going to do a beautiful job. And I'm like, oh, I just take it for granted each day that that's what we do. And to have this younger point of view is like, oh, yeah, we don't see it a lot. So I'm just saying hospice is less about dying and more about living the best we can until we die. Which is why Nancy and I wrote this book, the Hospice Care Plan book. It walks families and patients through step-by-step. How do you take care of the hospice patient? How do you manage symptoms? What does dying look like? What does transition and active dying look like? You can get a copy of it on our shop page. And hospices across the country are using it because it's really helpful. So get your copy today. Thanks.